Hello, everyone. My name is Sadia Maksood, and I am a program manager at Behavioral Health Division within Indiana Criminal Justice Institute. Today, we are conducting a webinar on crisis intervention team. Our today's presenter is Marian Halbert. Marian is the Criminal Justice Director at NAMI, Indiana. Previously, she has served as a Marion County Public Defender for 14 years and presented clients with serious mental illness in mental health court. As the Criminal Justice Director at NAMI, Indiana since 2011, Ms. Hubbard coordinates mental health and criminal justice trainings and provides technical assistance to communities across Indiana in developing crisis intervention teams to increase safety and to promote community support for the decriminalization of mental illness. Ms. Halbert is also on the Indiana Suicide Prevention Network Advisory Council, the Indiana Suicide Prevention Network Board. Without further delay, let's go to Marianne.
Thank you very much. Well, I appreciate you inviting me to present this webinar about crisis intervention teams. So we're just going to spend a little time going over the history of what CIT is, how it got started, and what you can do if you're interested in bringing this program to your community. Okay, so the first thing I want to do is just give a thank you to the organizational partners who helped develop this program and help support CIT. We're going to talk about how it started in Memphis. So want to give a shout out to the Memphis Police Department who really spearheaded this effort when it first started. And CIT International is the nonprofit who continues to hold an annual conference for CIT and also has an amazing amount of resources on their website, and NAMI, the National Alliance on Mental Illness, who helped start CIT by providing seed money with a grant to get it going when it first started in Memphis. And I want to talk about what NAMI Indiana is, since that's where I work. We are the state affiliate of National Alliance on Mental Illness, and we're a grassroots public charity. We help people living with serious mental illness and their family and friends. And we do that through supporting our local NAMI affiliates. So if you're interested, you can go to our NAMI Indiana website, which I'll be posting here today, to find out where the closest affiliate is in your area. And those affiliates provide support groups and educational classes about mental illness. We train our volunteer leaders so that they can lead those classes and support groups. And we provide education for professionals as well. We also partner for systems change at the state level. So let's go right into our talk about crisis intervention teams. Sometimes you'll hear it referred to as the Memphis model because it did start in Memphis, Tennessee. And unfortunately, it started as a result of a tragedy. At that time, Major Sam Cochran was with the Memphis Police Department, and there was a young man suffering from schizophrenia who was threatening himself with a knife, and his mother called 911, hoping that the people who responded would protect her son from himself. But unfortunately, within minutes of their arrival on the scene, the police had shot and killed this man, and there was a big public outcry because people felt like it could have been handled differently and that that man didn't necessarily have to die. So Major Cochran, who I've had the fortune to get to know over the years, and have talked to him a lot about how that started, he really recognized that first responders needed better training. He felt like his officers and his department were very well trained when it came to traditional policing, but they weren't really equipped to respond to people in mental health crisis, even though they were being tasked more and more frequently with having to respond to those individuals in the community who might be feeling suicidal or paranoid or having other symptoms of mental illness. So he really set out to have the best trained law enforcement department in the country when it came to responding to mental health crisis. So some of the major goals of CIT are to increase safety for the officer who's responding to the crisis, increase safety for the individual who's in crisis, and for the community or anyone who may be impacted by what's going on. And another goal is to dramatically decrease the number of people with mental illness who are being brought into our jails and prisons, because we know that there's overrepresentation of people with mental illness in the criminal justice system. And so for those who don't really need to be in that system and can be better served through the mental health provider system, we want to be able to divert them there. We also want to increase access to treatment and community partnerships. And we're going to be talking a lot about those partnerships because that's really the hallmark of CAT, and what creates that positive systems change is the relationships between the various stakeholders in a community. So these are the CIT core elements. And if anyone's watching this and we end up working together to bring CIT to your community, you'll hear me talk a lot about these. This is developed by CIT with the Memphis model and sustained through CIT International. And so if you're going to have a CIT program, these would be the things that we would be building. And it doesn't happen overnight. It takes time, but this would be the goal ultimately, is to incorporate all of these 10 elements into your program. Some people, when they hear about CIT, they really focus on the training, which is that bullet point that says curriculum CIT training. And that's important, but it's kind of the shiny object, you know, the 40-hour training for law enforcement. But if all you're focused on or all you're doing is the training, then that's just really checking a box and not creating that lasting systems change that's really going to have an impact. So that's why we do want to make people aware that there's a lot more to it. So the key to start with are those partnerships between law enforcement, advocates, or individuals and family members impacted by mental illness, and the mental health provider community. And you also have community ownership. So sometimes I'll get a call from, say, a sheriff or a chief of police saying, can you come provide CIT training for us? And the answer is no, because that would not be consistent with fidelity to the model, because it's supposed to be locally owned by the community. So the community members develop their own program, including the training, but we do a lot of handholding through that in providing that technical assistance. So you don't have to feel like you have to reinvent the wheel or figure it all out on your own. We help you every step of the way in doing that. But that way, you know that this program really belongs to your community and it's going to serve the community because it'll be tailored to meet those specific needs. Policies and procedures are another thing. If you're going to develop a CIT program, you'll want to look at policies and procedures within the various agencies that would be involved. So law enforcement departments, hospitals, mental health providers, to see if there's anything that maybe hasn't been reviewed or changed in a while that you want to take a look at through those conversations, and really assessing how is our system working, where is there room for improvement, where are our strengths that we want to reinforce, and take a look at those. Then you've got your operational elements, which is going to be your CIT officer, dispatcher, and coordinator, so that you've got people that are really, you know, moving the ball forward and coordinating this program. And then that curriculum, which we'll talk in more detail about in a minute, that's the actual 40-hour CIT training, primarily for law enforcement, although you will have some other folks that attend the class as well if you end up creating a CIT program. And the mental health receiving facility, emergency services. A lot of what we're talking about here, if you're familiar with the sequential intercept model, there are various opportunities to divert people with mental illness away from deeper involvement in the criminal justice system. And this is really that intercept one, where the person comes in contact with a law enforcement officer who has to determine how they're going to resolve the situation. Is this going to be resolved on the scene? Is this individual going to be arrested and go to jail? Or are they going to be diverted to mental health treatment services without having an arrest? And so you really want to identify within your community, if an officer is going to take someone for an assessment using our Indiana immediate detention law, where are the facilities that they could take them to? And that's going to vary county to county based on your resources. So you want to, as a team, look at that and determine where officers could take people for an assessment. Then those sustaining elements would be evaluation and research. So you can really assess your program and how it's working and where there's room for improvement. You want to do in-service trainings. So it's not just a one and done where someone's gone through a 40-hour class and never looks at that curriculum or material again. So they can have follow-up in-service trainings to either have a refresher on a topic they already took in the original class, or maybe there was a topic that wasn't offered in their class but is still relevant to crisis intervention, and you can offer training on that. And you also want to have recognitions and honors. So being a CIT officer takes a special kind of law enforcement officer. It's not for everyone, which, you know, the nice thing with law enforcement, like so many other things, there are a lot of specialties within that discipline. So if you're drawn to being a negotiator, or maybe some people want to be on the SWAT team or on the canine unit. If you're interested in crisis intervention and empathy and de-escalation, then this would be a great spot for you if you're a law enforcement officer, or if you know law enforcement officers like that. So we do want to recognize that they're not only making the commitment of a 40-hour training, which is a lot, but we hear really good feedback that consistently people find it more than worth their time because of what they get out of it. But then to actually be that person that's going to intervene when someone's in crisis. So they get CIT pins. We encourage communities to have publicity about your program. So maybe do an interview with a local news station. You can give awards like CIT Officer of the Year. However you determine is going to be the best way to really recognize and thank those officers who are drawn to this work and really engaged in it, because it does make a big difference. And then you also want outreach. So you're helping to develop CIT in other communities. So if you don't have CIT yet, we have officers from established CIT programs that will help you by lending their expertise as you build your program. And someday then you'll be able to do the same thing for a neighboring community in your area. So just as the foundation, to start a CIT program, at a minimum, you have to have 3 partners. And those 3 partners would be law enforcement, mental health providers, and advocates. You certainly will want to add a lot more to that, but you really have to have all 3 of these if you're going to say that you have a CIT program. Because as Sam Cochran, who's the grandfather of CIT, often says, CIT is not a law enforcement program. It is not a NAMI program. It's a community program. So it's really something where you need all these different perspectives coming together to create your infrastructure in your community. So with law enforcement, I encourage communities to invite every law enforcement agency within the county. So that would be the sheriff, all the different police departments. If you're in a town with campus police, that would include the campus police, or if you have a hospital system with their own police department, if you've got a state police post. So you really want to be broad there and invite everyone to the table. Not everyone might accept that invitation initially, but you certainly want to include them, because we never know where a crisis might happen or who might be responding. So we want to include everyone so that everybody's on the same page. Mental health, certainly your community mental health center is going to be a big partner, but you want to go beyond that to the hospital systems, emergency services, crisis intervention units, private psychologists and psychiatrists, if you have any that are willing to partner with you and help with your program, substance use disorder providers, all kinds of different folks. And then advocates would be those people like NAMI members, for example, who represent the voice of the individual or their family member who are impacted by mental illness. And then you want to obviously get a lot broader in terms of your stakeholder group, and we've got lots of suggestions for that if it gets to that point. Other folks that work in mental health and criminal justice, so probation, judges, prosecutors, people that do homeless outreach, all kinds of folks. Welcome at the table. Other first responders, dispatchers. One thing that I definitely want to emphasize is that the T in CIT is for team. Some people think it's for training, crisis intervention training. And again, like we spoke about a moment ago, there is training involved, and that's an important part of CIT. But the more important part of CIT is the team. And so that's why that's what the T stands for. So the team are the group of stakeholders that get together on a regular basis, those from mental health, law enforcement, advocacy, and other members of your community who work in mental health and criminal justice, to coordinate your CIT program. So you meet on a regular basis. Most communities end up doing that monthly, and that's just an ongoing partnership. And to assess and improve the way that your community responds when people are in crisis. And they also put together and host the 40-hour training. Then when there's an actual emergency or an actual crisis, it'll be a CIT officer who's gone through that 40-hour training who responds to the crisis. And the options that that officer has will be based on the infrastructure that your team has put together to strengthen that system within your community. So these are two what I call must-have resources. If you're going to start a CIT program, this is the first place I would direct anyone who's interested in just really taking a deep dive to learn more about CIT, what it is, how these core elements work together. So the first one is the Crisis Intervention Team Program's Best Practice Guide, and that was put out by CIT International in the summer of 2019. And it's available to either purchase for, I think it's around $20 if you want the hard copy of the book, like mailed to you so you can hold it in your hands, or you can also download it. It's available as a digital download. And that one I think is free, or maybe there's like a suggested $5 donation, but it's available to download. And that's just a really, really helpful guide to help you understand how CIT works. And then we launched a CIT Indiana coordinator manual, so you can take those, the framework from the best practice guide and learn how to apply it here in Indiana and create a program in our state. And both of those are available, links to both of those are available on our CIT Indiana website. So that's cit-indiana.org. So CIT really is about relationships. That's the key to crisis intervention teams, is working together to build that infrastructure within your community. When it started in Memphis, it was, I think other people heard about it, other communities, and it started growing throughout the country, and now it's around the world, which is why it's called CIT International. And we're trying to get it in as many Indiana communities as we possibly can. And so the CIT training, since that is a big part of a CIT program, is that 40-hour training takes place over the course of 1 week. You'll have multiple trainers with subject matter expertise. So you have a lot of different modules throughout the week, and many of those will focus on various mental illnesses. So you're educating the class, who is mostly going to be law enforcement officers, about schizophrenia, bipolar disorder, anxiety and PTSD, as well as suicide prevention, substance use disorders, autism, Alzheimer's. It's really the broad spectrum of mental illness. So they're going to get a lot of information. So you'd want to be thinking about who are our go-to people in our community who know that subject really well, who are treatment providers or other trainers that work in that area that can be a really dynamic and effective presenter for a law enforcement audience. You'll also have topics on the law. So a big focus would be educating them about Indiana's immediate detention law. So you bring in a local judge or attorney who is familiar with that and works in that area, who can explain the criteria for those, as well as the other aspects of mental health law that would be relevant to the officers. We also would have a large component of the training focuses on active listening skills and verbal de-escalation, because that's really what makes CIT different. Is while safety is always first, and sometimes traditional policing methods are going to be required to maintain safety, in those situations where time is on your side, if you're the officer and you can slow things down and develop a rapport and help use your verbal de-escalation skills to help calm that person down and resolve the situation more safely that way, that's going to be preferred over a quick result. So we do spend quite a bit of time of the 40 hours, usually about 6 to 7 of those hours are going to be on the active listening and verbal de-escalation training, and then role playing so that the officers in the class have a chance to practice those skills and get feedback in that safe setting. And part of any CIT class is also going to include interacting with people who are in recovery. So we would have NAMI volunteers who have been trained to share their story with law enforcement come into your class and spend some time with them, just sharing their story of what it's like to live with mental illness, and be available if the officers have questions or just want to understand more about that, because that's really important to help break down stigma. So CIT really is a novel approach because officers are trained in the use of force, but sometimes even when they're doing what they were trained to do and doing it all by the book, that can backfire if you're using traditional policing approaches on someone who's suicidal or someone who's paranoid or hearing voices, or who might be experiencing a manic episode or a panic attack. And so we just want to help officers understand what may be going on with someone in those situations, so that they're aware of what's happening and can use their discretion then based on having more tools in their tool belt to decide what type of approach is going to be most appropriate and effective to, number one, maintain safety, and number two, resolve the situation in the way that they feel is going to be the best. So again, when time's on your side and you can slow things down, this is a great option that a lot of officers have expressed they appreciate, knowing that they've got other alternatives than just arresting the person just to resolve the situation. So typically how it works is someone would call 911 and identify a mental health situation, whether they specifically ask for a CIT officer, if they're familiar with CIT, or if just what they're describing, the dispatcher knows through the dispatcher's training that this is a mental health crisis. Then the dispatcher would request a CIT officer. Now it's going to be up to your community and your law enforcement agencies to decide how they want to handle this, but pretty typically, most of the time they'll send the nearest available officer just to be a presence on the scene to maintain safety. But then as soon as the nearest available CIT officer arrives, then they would take over the scene because they have had that 40-hour training and a lot of, information on how to de-escalate. So typically they would take over the scene at that point. But again, that's going to be up to your committee and your law enforcement agencies to make those determinations. And too often we do see individuals in the community who are impacted by serious mental illness, but they don't have adequate supports. A lot of times, if they begin to experience symptoms of their illness, because they may be untreated or undertreated, sometimes they come to the attention of law enforcement. And so that's really why we create crisis intervention teams, so that those law enforcement officers have the information at their disposal that they need to be able to respond confidently to that situation. So you can become part of the team. If you don't have CIT in your community, then you can start drumming up interest among the stakeholders that who may work in criminal justice, mental health, or advocacy, or these other disciplines that are related to that, and create your stakeholder committee. And then part of what you'd be doing is putting on this training, like I said, but that would be with our help. So at the training you do, as we just discussed, learn about the mental illnesses, interact with people in recovery, learn those verbal de-escalation skills, and also learn where community resources are. So it's very specifically tailored to your community. So people going through the class will know where services and supports are available. So CIT in Indiana began in 2001. Like we talked about, it launched in 1988 in Memphis, Tennessee. But the first CIT program that existed in our state was in Allen County, with the Fort Wayne Police Department spearheaded that. And if you want to see where CIT exists now, we do have a map on our CIT Indiana website. So again, that's cit-indiana.org. And you can go there to the local programs tab and just click on the map so you can see where it exists and if there's one near your area. And CIT really is more than training. It's a philosophy and culture change within a department and a community. And so it's really a program that includes a training. And it does save lives. We've heard from many people. I've heard from law enforcement officers who really felt like it saved their own life, that they were able to keep themselves safer through their verbal de-escalation in situations that prior to knowing about CIT or having those skills, they might have inadvertently escalated a situation without realizing it. And we've also heard a lot of interventions regarding people who were suicidal, where the officer who responded used their CIT skills and were able to get that person the help that they needed. So we do know that it saves lives. And so we feel like it's just something that we would want to bring to every community if possible. So these are just some results of CIT. Like I said, Fort Wayne started their CIT program in 2001, and they kept statistics every year for many years about what their numbers were in terms of the types of calls they would get that their officers responded to. So I just wanted to share this with you as an example, so you can see in a community that's really embraced the philosophy of CIT, how that can work. So in 2016, there were 1,520 calls that were responded to by Fort Wayne Police Department CIT officers. Over 1,100 of those were suicide related. Almost 400, the person was under the influence of something. 170, they were armed. 1,486 immediate detentions where they were taken to the hospital for a mental health assessment, and only one arrest. So I think those are pretty powerful numbers that really speak for themselves. That those are situations where probably the officers could have arrested the individual if they'd wanted to for other things, but out of all those calls, they only made one arrest because they really believe in diverting people in crisis to treatment rather than jail. So if you want to develop a CIT program, we do provide technical assistance from NAMI Indiana to help you do that. The first step would be identifying who should be at the table. Who do you want at your steering committee that would have a voice that you'd really want to have there? Adhere to those 10 core elements. We would have you go through a train the trainer. That would be for the people who are actually going to be teaching the verbal de-escalation or role play portion of your training. And then you'd host your first class. And you and your stakeholder group would continue to meet regularly to improve your community's response. So the moral of the story is having a mental illness isn't a crime, and it really shouldn't be treated as such. So if there are situations or opportunities to divert people away from the criminal justice system, we want to be able to provide that option when it's appropriate. If you have more questions about CIT or you feel like there might be some interest in your community, feel free to reach out to me and I'd be happy to discuss that with you.
Thank you, Marian, for this interesting presentation. I hope that the information you shared with us today is useful for those counties that are planning to develop programs or trainings within their communities that require mutual engagement of the individuals from the prevention, treatment, and criminal justice sector. If anyone is interested to know more about CIT training or has any questions, please reach out to Marian. The contact information is included in the slides, as you can see here on screen. Thank you very much for your time.
Thank you.